Hi, and thanks for joining us for our podcast. I'm Holly Gaddy, and today we'll be speaking with Kimberly Benson, lead therapist for Enterhealth. Enterhealth is a premier behavioral health provider specializing in mental health and substance abuse treatment services. And today we're going to be talking about a really interesting topic, holiday depression. With the holidays coming up, ways that people can mitigate it or perhaps avoid it altogether.
Mm-hmm.
So thank you
for
your time
having
today.
me.
What are the main causes of holiday depression?
That's an actually interesting question. Most people think, oh, it's such a great time and happy, but a lot of people really do get into quite the holiday blues, the holiday funk is what they call it. Anything from when people are having isolated lives, they've had family conflict, things that have caused throughout the year in a family dysfunction or anything of that nature. It can also be derivative of people who live separate lives or isolation due to COVID, working from home, different isolating style events. Pressures to socialize are a really big deterrent for people for holidays because they're like, I haven't been with these people all year. And then we have holiday parties and gatherings. Some people are in recovery, and those are situations where a lot of people are drinking, and it makes it a little bit more difficult for socializing. This is also a time where people start comparing themselves to others. This one has a whole lot more. They can probably afford more Christmas for their families. I can't, and that makes it a little bit more difficult as well. People also really struggle here about loss and grief in their life, and so they're missing loved ones who may have passed away or have moved out of the home. A lot of times where our young people, we encourage them to go explore and go to college and do these things. A lot of times they're out having their new lives as young adults, and that at-home feeling of things aren't going to be the same. The holiday traditions are not the same as when they were little. Those things are huge. With the way the holiday temperatures are, that lack of actual sunlight, most people are like, wait, how do you mean? Actually having rain or snow or gloomy weather causes people to also be in a funk. And so oftentimes, especially like here in Texas, we get a lot of rain and sluggish like weather. People really do get into a funk then too, and that's most of our holiday season. All of these things really do increase the depression. The last one that I've noticed is the expectations of gift giving. Like you're at the job and everyone expects you to give them a gift. Everyone expects something out of you. It's also the end of the year where people are put a lot of pressures for work, where they're trying to get those last numbers in for potential holiday quotas or end of the year quotas, or maybe for end of year bonus considerations. So they're really pushing and putting a lot of unnecessary pressures on themselves. All of these things help to contribute to holiday blues, holiday funk, holiday depression.
Who would you say is at a heightened risk for having holiday depression?
Everybody. Really, it's interesting is people who have already had predisposition to situational depression or depression, chronic depression throughout their lives, or already been diagnosed. Those are definitely people who would normally have it. Anybody who's experienced extreme trauma or grief, or any new trauma and grief throughout the year. People who have significant social anxiety or struggle with being around others.
Mm-hmm.
With COVID, interestingly, there was a heightened set of cases of people who become agoraphobic that decided to stay in the house because they were afraid of what COVID was going to give. So these are also increased. People with substance use disorders tend to have increased risk for holiday depression. Anyone who is struggling with unrealistic expectations or pressures of themselves. We see a lot of people in advanced degree fields, lawyer and law school, medical and med school patients tend to be at more heightened risk for depression during this time. And then a lot of times people neglect this part are the parents of really young children or anyone with special needs. It brings on a great deal of risk factors. The pressure to put on the most magnificent display around the holidays, we don't check on the regular parents. We're thinking, oh, this must be the greatest time for you. It's so much fun as having little ones, but it's a lot of pressure for parents to be in these situations. But really, anyone can be affected by holiday depression. We need to be really paying attention to signs, symptoms, and cues in people, and that can actually help us to identify someone who may be kind of getting into a funk or that's already there.
Mm-hmm. Kimberly, thank you so much for these insights that you've shared today and for walking us through how we can mitigate or avoid holiday depression.
Thank you.